Hi, everyone. We're going to go ahead and get started. Thanks so much for joining us today for part of our New Mexico Interdisciplinary Clinical Supervision Training Series. I'm Jen Panhorst, licensed clinical social worker at UNM's Division of Community Behavioral Health. I'm excited to see so many folks who I know have been on some of our other presentations in this series. So a lot of you already know the drill. But yeah, we've got two more that are coming up, the 2 Fridays after this. And Alex is going to be sharing the flyer for that at the end, and the link, just to remind everybody how to access those. And just a reminder that in order to get credit for this presentation, you do need to stay for the full hour. And Alex will be covering the CE information at the end. So without any further ado, I'm going to hand it over to Dr. Christopher Morris. Thank you so much for being here with us today to talk to us about supervision in rural New Mexico.
Thank you, Jen, and welcome everybody. I'll just introduce myself briefly, give you a little bit of a sense of my background. I'm a clinical psychologist, and I've been with UNM for about 8 years, over 8 years now. And my full-time assignment is in Sandoval County. I'm the medical director of our outpatient behavioral health clinic in Rio Rancho, and then also medical director for behavioral health at UNM Sandoval Regional Medical Center. And it's been a really rewarding position for me at UNM, and wasn't necessarily something that I aspired to. Really, most of my career has been working in community settings throughout northern and central New Mexico, as well as in northeastern Arizona on the Navajo Nation. And I did my clinical training in Utah and lived and worked in rural communities in Utah, Arizona, New Mexico. So that really has been my career, and that's why it's especially pleasing for me to be able to be here with you today to talk about this topic. And I will scroll through a couple of notifications that we need to look at. Most of you are probably familiar with the CE process. If any questions on that, Alex will be able to address those questions at the end. We've got a couple of disclosures here and our learning objectives. And I do want to take kind of a broad lens initially and talk a little bit about why does rural clinical supervision matter in New Mexico. And obviously it matters to supervisees who are working in the field, whether they're working at a paraprofessional level under supervision or with a non-independent license trying to get to the next level. But it's also important from the broader perspective, really, for our workforce and our service delivery system. So we'll talk a little about that. Then we'll dig into some of the very specific challenges that come up with rural clinical supervision and some of those solutions, looking at really a strengths-based focus on that. And then we'll shift into what can you do, sort of going from those strengths into some more specifics about what you can actually do as a supervisor or as a future supervisor if you're still preparing for that role. So without further ado, we'll move forward. Why is clinical supervision important to rural behavioral health? Well, we know that we live in a rural state, really a rural and frontier state. We have very remote parts of our state that definitely qualify as frontier areas. We also have a behavioral health workforce shortage that we've had for a long time. Doesn't show any signs of going away at this point. I think despite many of our best efforts to try to improve the situation, we keep at it. But we're in a shortage situation, and we're gonna have to keep working at that for a long time. Also, whether you work in a rural or an urban area, strengthening rural capacity benefits all of us, regardless of which setting we really work in. If care is inadequate in rural areas, then people's problems get worse, of course, and they end up accessing more specialized care or safety net care. Some of them are going to come ultimately to the higher levels of care or the urban setting. And so it impacts everything statewide. When we've got stronger local care, it obviously is associated with better outcomes for our clients, but it also reduces the demand on those safety net systems and on the higher levels of care. And furthermore, just ensuring that good, solid local care is available is really consistent, I think, for most of us with our professional values and ethics. So this is a fundamentally pretty important thing for us to be involved with in whatever manner we're able to be given our work setting. I'm a kind of a map junkie, so we'll see several maps as we move through today's presentation. I especially like this map because it shows the counties. And when you're thinking about rural practice, it's very important to become familiar with the characteristics and the culture of specific rural areas. And counties are important in rural areas. If you live in Albuquerque, it's like, well, yeah, we're aware of Bernalillo County, and Bernalillo County is a little bit different from city of Albuquerque, but for most of us, unless you happen to live like in the South Valley or some of the incorporated areas, county versus city is not that big of a deal. But in rural counties, county government is a big deal. And many people do identify with their county that they're from. So it's part of identity. It can be a part of the culture. And so definitely for those of us, especially if we're supervising remotely to rural areas, it's important to be aware of the county and some of the characteristics of that county. So I love the map. It gives us a visual of that. Also a couple of quotes here as we move through the presentation. I've got a variety of quotes. Some of them are from the literature. I found a few good things in the literature, not a ton of literature out there, but a few good things. So some quotes are from there, and then some of these are from colleagues, people I've known and worked with over the years. And so this idea that we must have a focus on staff development versus program development, as often our only resource is our staff, not a new program. So when you're in a rural area, you're working with what you have, right? That's just part of it. And so definitely creating those opportunities for staff to come in and move up a career ladder and grow and develop within the organization. And supervision is just a crucial part of that, right? Training, of course, is important, but supervision is where the training gets put into practice. And so we have to grow our own. That's what we have to do. And I know cannabis has gotten big in our state these days, but that's not what we're talking about. We're talking about growing our own workforce. So another aspect to that in terms of thinking about our staff, thinking about our people, is focusing on support and retention. In a shortage situation, again, we want to make the most of what we have. We want to hang on to our folks and help them to develop in place and continue in their roles and advance in their roles. So again, there's that concept of a career ladder, right? If we think about some broad general strategies for how supervision and professional development can help address the workforce needs, we can think about training and professional development of new behavioral health providers or helping people move to new levels of practice who are already residing, living and working in rural communities. We also definitely need to think about support for our existing supervisors who are already living and practicing in rural communities. Then we also need to think in terms of recruiting and preparing new providers who may be interested in relocating to rural areas. Obviously, most people are in those population centers, and so there's going to be at least a small number of individuals who really might be interested in living and working in rural areas. So we want to find them and prepare them. And then, of course, we've got some concentrated resources in the more densely populated urban areas. And so we want to utilize those resources as best we can to support and grow that rural workforce. As we think about doing these things, so some things start to come to my mind. utilizing telecommunications, telesupervision, telehealth technology is definitely a way of leveraging those urban resources and supporting the rural areas. We also need to think in terms of our supervisors who often in rural areas will be covering multiple roles. Again, sort of making the most of what you have. It's a theme in rural areas. So that does mean that people at a supervisory level tend to be spread pretty thin, tend to wear many hats. It also means that they've often advanced rather rapidly to leadership and supervision roles, more rapidly than we might see in urban areas and in larger organizations. So really making sure that we're preventing burnout, that we're providing supervision of supervision so that supervisors have that good support. And so that we're really thinking in terms of preparing that next generation and supporting and retaining the folks that we have. So if we can get a little bit of audience participation going here. Go ahead and type in the chat, what is one of your favorite things about the rural part of New Mexico that you're most familiar with? And even if you don't live in a rural area, you probably visited and been around our state. So just share with us, what's one of your favorite things about rural New Mexico? And then also, if you would, in the chat, type in something that you've observed as a significant either a behavioral health challenge or a socioeconomic challenge for that rural area that you're familiar with. We'll just get some snapshots of what's going on out there in rural New Mexico. And I do have here on the slide also a picture from one of my favorite rural behavioral health agencies in our state, Guidance Center of Lee County. Definitely superheroes over there in Hobbs, as well as some of the other smaller communities in the area. And, really just a rock star agency, super solid, well run. They get it. And you can just see here with their guiding principles on the poster, how powerful their values are and how it supports the work that they do. And I'm gonna take a look in the chat, see what we have here. Yeah, so people are talking about that rural quality of life, scenic hiking opportunities, outdoor activities, the outdoors, the community, right? The people. Some of the challenges, lack of access to internet connectivity, huge issue. At the same time, being more connected to local resources, people knowing each other, having that opportunity to work together over a period of time. And we will talk a lot today about the importance of relationships for rural practice. Not a lot of traffic or overcrowding, absolutely. When I think about many of the rural commutes that I've had over the years, I may be driving 50 miles. It's a long way to commute one way every day, but it's a beautiful drive, right? And there's no traffic. So someone in an urban area might be spending just as much time in their car as I am, but they're in traffic, waiting at stoplights. I'm out in the wide open spaces. Gotta love it. So the people with the long-term ties to the area, really a source of strength, right? But distances are a challenge. Wait lists, access to care. Access to care is limited, especially access to specialized kinds of care. Finding support and supervision for supervisors, you bet. And so many of us here in the session today, we can support one another. If you're a supervisor or a supervisor to be, this is a key point, right? Is that we got to support each other as well. Challenges in terms of social life, social relationships, and access to some of those nice things, entertainment, shopping, etc., can be pretty limited, right? So definitely there's pros and cons, there's strengths and there's challenges. Okay, now I like this graphic from Montana State University. Montana, of course, New Mexico, fourth largest state in the lower 48. Montana is the third largest, so they're one notch above us, and then Texas and California, the top two, and then of course Alaska, way up north. But Montana State, they're pretty focused on rural practice and rural workforce. And so here's an initiative they have going and a little model that they've written up. And this idea that as we're preparing our workforce, step one, orienting people to rural life. If they're being recruited in from other areas, it's a big change. So getting them oriented to that, creating practicum experiences, creating supervised experiences in rural settings. In steps 2 and 3 are both all about that. And then really supporting that rural professional practice. And that if we support that practice with good supervision, supervision of supervision, then we're going to have a more sustainable rural system. So this is definitely something we need to be intentional about. It's not going to happen by itself. Who's involved in this? We can kind of think about 4 main groups. We've got rural supervisors who are working in rural areas. Urban supervisors providing remote supervision to rural areas. Also keep in mind that rural supervisors also often provide supervision to remote areas. So we have agencies that are serving multiple large rural counties, and a supervisor may have responsibilities across a pretty large geographic distance. So they're also supervising remotely. And then we have our supervisees, and supervisees could be seen in kind of 2 main categories, at least demographically, that there are those who are local, really from the local area, and then rural supervisees who are not originally from the local area. And they could have come from larger population centers, or they could have come from other rural areas. So I'll just challenge you to think about, well, where do you fit in here? And you might be in more than one of these groups. So just kind of think about that. Where do you fit? And the other supervisors and supervisees that you interact with, where do they fit? Just kind of getting a sense of the people. So I put in a plug earlier for Guidance Center of Lee County. Here's another great rural agency, Hidalgo Medical Services, down in Silver City and Lordsburg, as well as some of the smaller communities in their counties. And this is gives us a sense of a few things that jump out at me from this is their homepage on their website. So they're a federally qualified health center, so they're doing not just behavioral health, but also medical and dental care. So an integrated model, or at least that's what they strive for. And this is a common model in some rural communities. Also notice that they're a nonprofit. And, sometimes when we think of a nonprofit, we think of that as being free. However, revenue is scarce, right? So actually, of course, they are billing insurances and people have copays and things like that, in addition to serving Medicaid clients who wouldn't have copays or costs. So just a sense of a little bit from thinking about HMS of the scope of such operations. It takes a lot to deliver rural behavioral health care. Okay, so what are some of those challenges? Sort of foundational principle that I always keep in my mind in rural practice is that the resources and funding for health and human services are always scarce in low population density areas. Most of these things are based on a tax base, and in a low population density area, tax base is smaller. There's just less people, less businesses, less stuff. Tax base is smaller. So the resources are spread thin over these large geographic areas. That also, an implication of that is that specialty services are often just not going to be available. Again, low population density, well, specialty services are for less common, more specialized needs. And so I think about something like, for example, eating disorders. Obviously, a very serious condition clinically, something to be taken very seriously, but relatively lower in prevalence than, let's say, substance disorders, right? It's hard to impossible to access specialized eating disorder care in rural areas. It's not going to change. You know, you may get lucky and happen to have a provider who has that interest and has that specialty, and you're lucky because they just happen to live there, right? And it's an area of interest and specialty for them. But when they retire or leave, it's gone, right? So this is just sort of part of what we're dealing with in a rural area. Another sort of main underlying challenge is that a lot of our traditional clinical supervision models don't really meet rural workforce needs. They're not designed for rural settings and the rural workforce. They're not developed in rural settings. There are some colleges and universities that are in rural areas, but more colleges and universities are in urban areas and have that urban focus. So an example of that focus is really emphasizing individualism, sort of mainstream view on things, as opposed to the interdependence and the importance of those relationships that we've already mentioned in the chat in rural areas. Rural cultures themselves can diverge pretty sharply from those urban perspectives. And for college students who are in a large urban setting, spending several years at a university, developing their own identity, oftentimes as young people, and developing their sense of their own values in that kind of a setting, which is likely to be more progressive, and then locating to a rural area that may be sometimes politically conservative, but sometimes just more conservative in terms of general approach to life, right? The pace of change is slower in rural areas. And that can be a real culture shock for new providers who've not been in that setting. And it can even be a major readjustment for someone who may have grown up in that area, went away to school, and now returning home after several years of significant learning and identity development in a university settings. Okay, so this particular reference that I have cited here, Paulson 2010, this is a great article. I would recommend this. It is in the references at the end of the PowerPoint, and the PowerPoint's available if you want to get a copy. Just shoot an email to Alex. I won't go way into their methods of the study, but they did do a qualitative analysis based on surveys and interviews with rural supervisors, and they identified these 5 major themes. Rural interdependence, something that's already come up, the lack of resources, role overload, wearing many hats, isolation, which can be both professional isolation as well as social isolation, kind of 2 different things that come up in a couple of different ways. Professionally, just not as many colleagues. You might be working at a behavioral health agency, which is the only behavioral health provider for 100 miles around, right? That's just what it is, or maybe 50 miles to the next county and the next agency. Not as many colleagues to draw upon, to turn to, primarily going to be colleagues within your agency. So professional isolation, definitely something to be aware of, and try to be intentional about building some things in to create those connections. Training series like this one can help. So definitely making sure that you're availing yourself of those kind of resources. The social isolation, not only because it's a less densely populated area, but because if you're working as a behavioral health professional in a small community, you're likely to run into your clients really anytime, any place, at the grocery store or wherever. And so having to be aware of your maintaining a professional demeanor even in your off hours, being aware that people you may encounter casually in social settings in a rural community could be closely related to your clients. Just having to really be a little more cautious about cultivating social relationships, depending on how small the community is. This can become a pretty difficult challenge for a practitioner. And then the ethical and cultural challenges. Ethical challenges, we'll talk a little bit more about those. But again, thinking about the scarcity of services, having to practice and supervise as a generalist, issues related to competency and scope of practice that a supervisor or a supervisee may often be pulled to work beyond their comfort zone in terms of their competency and scope of practice. These are some significant challenges that can come up. So let's drill down into some of that complexity. Here's another good quote. This is from Paulson as well. There's a distinct cultural differences in rural areas when you talk about diversity. Being rural is a special client group. The value systems are just different. It's important to know the culture and community you work with and make sure supervisees also know the community. So really, when we think about culture with all its depth and breadth, we do need to recognize that rural is cultural diversity. It's very important to remember and to help supervisees internalize that rural is not less than urban. There may be less stuff, there's less stores, there's less nightlife, less people, but rural is not less than urban. It is a distinct identity and culture and life way. There's strengths, there's things to value about it. There are also challenges. So folks who are not from the local area may need some extra support to really understand and appreciate those cultural differences, not just see them as barriers or problems to be overcome, but really appreciate and value that diversity. I mentioned already some of the challenges that can come with working as a generalist. And we're not all trained as generalists. I was fortunate in my graduate program that was our program, and I had that pre-service training. Not everybody necessarily got that. You know, we went to school where we went to school, and we didn't necessarily know where we were ending up or what we would need. And so this may be something that you have to really cultivate and develop over time, having that generalist skill set. So again, just thinking in terms of geographic scope, I used to work for Navajo Nation Division of Behavioral Health, and so here's looking at this map, and Albuquerque way down there in the lower right-hand corner. And then this goes all the way over to Page, Arizona, and Lake Powell, just a vast area. And so when you think about the diversity and the challenges, it's a lot. And another map. I told you I was going to throw some maps at you. So let's think about diversity in another way. I think it's pretty obvious to any of us that if you work for the Navajo Nation, especially if you're not Navajo, that you're going to be immersed in a culturally very different setting. But we sometimes don't recognize that as well in other settings. And just think about if you know the state pretty well, think about Roswell and Silver City. They're way different, right? And anybody, I'm going to make sure I keep my eye on the chat here too. Sorry, got too many things going on my screens. But if you feel like chiming in on the chat, just thinking about some of your own observations about how much diversity we have in New Mexico, how different Taos is from Las Cruces, right? And think about south of Las Cruces, for those of you who are familiar with that area, Anthony, and heading south towards El Paso. So much diversity within our state, right? Thinking about the cattle country, I think of it as cattle country out there towards Springer and Roy and those areas. Very different from Taos, which really geographically not that far away, right? Lots of complexity. Okay. A few more things to think about in terms of diversity. Rural populations are often disproportionately older. We just know this from the demographic data. Older adults have different needs and different perspectives than younger people. And so when they come to us as clients, when they come to us in behavioral health or human services, understanding their perspectives and their needs is going to be very important and could be especially challenging for some younger people entering the field. So as supervisors, we want to be attentive to that. Other examples of diversity common in rural areas, migrant and other seasonal populations. Economies in rural areas are often associated with the extractive industries, mining, and so forth. Those tend to be very cyclical, right? They're on kind of a boom and bust cycle. So that's going to affect people's needs and cultures and who's even in the area at any given point in time. Tourism, very similar. There's a lot that happens seasonally. People are coming and going because employment opportunities are changing. And then, of course, in our state in particular, our Native American communities and the more traditional Hispanic communities, and just being aware of the culture and the history and the dynamics that influence what happens there and the needs and perspectives of folks. Other things, it's relatively common in more rural areas for a single clinician to be serving multiple members of a rural family. Many of us in our clinical training, we were expressly told, don't do that. But this is just common in rural areas, and it actually can produce some very real practical and clinical benefits. Requires careful attention in supervision and practice, however. The boundaries certainly become more complex in those kinds of situations. I've already mentioned the scarcity issue and some of the challenges that come with level of competency. And so supervision is going to be critical. Keeping an eye out for those training opportunities and the support as we're having to expand our scope of practice. Another ethical issue that comes up is when there's just not going to be the type of care that a person needs. It's not there. It's not practical or feasible for them to go to an urban area and get the specialized care. And from an ethical standpoint, how do you manage that as a practitioner? Complexity, right? So many strengths in rural areas. I love this quote: if there was a felt need among people, it would happen. And that has been my observation as well. Really cool metaphor, rural relationships are like invisible sidewalks. Some small towns will have sidewalks, like in the sort of the core of the little small town, and things were built at times when sidewalks were built. But really, not a lot of sidewalks in rural communities once you get outside of maybe that little core part of a small town. But the sidewalks are invisible. Those relationships really connect people and literally create pathways to get things done, to make things happen. So tons of strengths. I like to think about the balance between self-reliance and social connectedness. It's almost sort of like a dialectic that there's both, there's both at the same time. And both of them are sources of strength. Um, the space is also a strength, the space and the beauty. And yet that also leads to geographic challenges with distance and isolation. And rural culture is creative in terms of finding ways to adapt and cope with that. The informal networks, the collaboration, the values placed on helpfulness. Um, I always remember when I first went to graduate school in northern Utah, and one of my classmates in the doctoral program, she was from North Dakota, so she was no stranger to rural communities, but she was just so pleased and happy. Her first week or two there, she had a flat tire, and was over, by the side of the road trying to figure out what to do with it, and she wasn't necessarily ready to figure out how to change it herself. So quickly, somebody stopped to help her, and it just went great, and she felt right at home being from a rural community herself. So just that kind of mindset, which things have changed. That little story from graduate school was 30 years ago, and that's a long time, and some things have changed, but also some things stay the same. So really talking about the importance of relationships in supervision, and helping the supervisee to learn how to tap into that, how to utilize that source of strength, also how to navigate the boundaries, because with the fact that the relationships operate differently in rural settings, of course, there are still boundaries, and we have to figure out how to do those appropriately. So definitely important areas for supervision. A little bit more thinking about relationships. Couple of these things we've already touched on, but really drilling in a little bit more into dual relationships or multiple relationships. Again, something many of us were taught in our training to avoid dual relationships. They're risky, they're not good, but they're not inherently bad unless there's potential for harm or exploitation. And so certainly a good rule of thumb to limit them when you can. A good example of doing that is as a supervisor in a rural setting, in a rural agency, not developing a lot of personal relationships with your coworkers, right? Because you're already going to be dealing with dual relationships because your colleagues relative or your supervisee's relative is the person who cuts your hair at the barber shop or whatever. You could go on and on with the ways that we're going to run into people. And so if you can limit those social relationships at work, okay, well, then that's that much fewer dual relationships. But there are going to be many situations where they are necessary and even beneficial. And so identify clearly then what is the nature of the multiple relationship. Get that really clear in your head, and then communicate with the parties involved appropriately to set those clear boundaries and really define the relationship. So multiple relationships have to be actively managed. That's the main takeaway there. Again, just a very important topic for supervision, a very rich topic in supervision. It's important to really be intentional about planning to meet the needs of rural supervisees. As I've been talking about, it's different, right? And so just winging it is not the way. Really thinking about the differences, thinking about the specific needs, and being intentional about how to meet those needs. Developing a rural model of supervision. This isn't just a mode, this isn't just a setting. You really need a model. Flexibility and creativity are important. Pragmatism, I think, is a really important rural value that we can all utilize. being practical, flexible, creative, as we go forward with integrating many of these complex factors that I've been talking about. Also, definitely a good thing to always keep in mind when we're talking about workforce development, we want to make it feasible for our supervisees to stay and to work in these settings. And there are some benefits in terms of loan repayment. So at least just know where the websites are, know where the information is for the National Health Service Corps. Indian Health Service has a great loan repayment program, and the state of New Mexico now under our current governor has developed some loan repayment options as well. And I put the little National Health Service Corps thing here on the slide because I think it's also important to notice that it's not only about getting your loans repaid, although of course we all like that, but noticing the values here. If you're working at a Health Service Corps site, that we are serving everyone, right? Without regard to their background, we're serving them without regard to their ability to pay. And for many younger folks entering the field, we're all idealistic when we're young. Hopefully we retain some of that as we get older. But the opportunity to be of service is very important to many people entering the field. And if you can both be of service and get your loans repaid, then it's a win-win. So definitely a thing to talk about. Okay, technology. This is a very important slide. This could be an entire webinar in itself, right? But I just have one slide. Let's take a minute with this. It's not just video conferencing. It's really important to be fully utilizing the whole range of technology for scheduling, for communication between supervision meetings, for chart review and co-signatures, if that's a part of your supervisory role, making sure that you're utilizing the full range of technology. Get familiar with best practices in telehealth. Again, could be an entire webinar in itself, but a thing like they say, well, make sure that your where you are in your screen is about 1/3 of the total width of the screen. And if you look at me on the screen, I pretty much have it set that way. That's just a simple thing. There's other things. Model these things with your supervisees. If they're not getting it, if they're struggling with if you're doing telesupervision and they're struggling with it, talk about that. Make that a part of the supervision, right? Let's figure out how to do that. The functionality of the technology is key. Figure out what is the best technology, and especially for you and your supervisee, depending on, you may not be in their agency, right? You may be providing remote supervision and you're not working at their agency, so you won't necessarily have control in that situation over what the agency uses, but you can control, what the two of you are using. And so just figuring out what works the best. And if something's not working properly, let's troubleshoot and let's figure that out. And again, you're modeling that for your supervisees because they're probably going to be doing telehealth themselves, right? If they need specific training on the technology, well, you can try to do that yourself, or you can try to help them obtain that. The main takeaway there is just helping folks to know, it's just, we know about nonverbal communication. This is part of all of our training. And so making sure that the verbal aspect is working to the best extent possible. Sometimes our clients are going to have bandwidth issues and things we can't control, but also sometimes we can coach our clients through ways to improve that, so that we have the best possible connection in telehealth. And again, in supervision, you've got an opportunity to explore those things and do it in real time. Really emphasizing with folks that phone only is not going to be our go-to. There are times when you have to fall back on it and you're in a pinch, but we're going to plan for video and we're going to do what it takes to make that happen the majority of the time. Also, really important issue if you're doing distance supervision with technology is having a really clear plan for the supervisee to get the supervision they may need in an emergency. How can they access you? Or if they can't access you, then what's plan B? Okay, moving into some more key issues in supervision. Confidentiality and privacy. So we've talked a little bit about that in terms of that clients know each other, they talk to each other, um, they know each other in the community, and they know that they're both seeing you. How do you handle that if one of them brings up that fact during a visit? Just really being able to navigate those confidentiality rules and requirements, as well as just the boundaries, which may be a little less formal in nature. Stigma and prejudice. In a rural community, everybody knows everybody and everybody knows a lot about each other's business. And with that can come stigma, judgmental, people being just judgmental towards one another, really prejudiced, judging one another. And so in supervision, just really talking that through and how we as professionals do have a responsibility to do what we can to address those issues, to reduce stigma in our communities. What does that look like? Both in an individual client relationship, in an agency setting, and then also in our community work and our relationships with the community. I've already talked about multiple relationships, that generalist scope of practice, and sometimes the insurmountable barriers to obtaining needed care. So if it's just not going to happen and a person is going to have to only get partial care or part of what they need, ethically, what do we do with that? And how do you make sure that you're doing everything you possibly can, and then setting those limits where you can't go any farther, and processing that with the supervisee. Definitely in terms of thinking about, well, what can we do and how far can we go? Sometimes we may not be able to solve the situation for an individual client, but we can begin working at the policy and systems level, advocacy, systems change. And so incorporate that in your supervision, to help the supervisee really recognize, well, okay, these are avenues we do have as professionals. It may not solve the problem today or tomorrow, but we might be able to solve it by next year. Right? What does that look like? Again, can be very challenging, especially for younger supervisees, the timeline of that and the pace of change. So processing that and addressing that in supervision as well. For folks who are relocating into the area, being prepared to address that in supervision, just their own process of adjustment. I definitely see as part of supervision is that, think about it, we're wanting this person to be able to be successful in their professional goals. And at this point in time, if they've moved to that area, then that is their professional goal, to live and work in that area. We hope they'll stay long term. That, of course, will be their decision, but we want to help them to be successful right now as well as in the future. So really processing their experience, doing some problem solving together, generating options for them. One of the things that had been brought up in the chat is like, yeah, access to social entertainment, shopping, all those kinds of things, restaurants, it can be limited. And so, creatively problem solving together, like what are some ideas for how to address that, and how to do it on a potentially limited budget. And again, really seeing these cultural, clinical, and interdisciplinary difficulties, differences, not as difficulties, but as rich sources of making our supervision process stronger and making our process of providing care and services stronger. So really leveraging those differences as a dynamic force. Capitalizing on strengths while acknowledging the vulnerabilities. There are vulnerabilities in every culture, right? There's always the Achilles heel, usually several Achilles heels. So we can acknowledge those. You know, there's an example here in some rural areas, there's a lot of mistrust in outsiders. That can really result in prejudice on the part of some local people, and that's a vulnerability, right? So we can acknowledge that. Sometimes we may be able to help shift that in some cases, but also realizing that just because there's a vulnerability doesn't mean it's our responsibility to change it, right? Other people own their strengths and vulnerabilities. And so we may be aware of some weak points. It doesn't necessarily mean that we need to change that, right? It's not for me coming in as an outsider to say, y'all need to change. So that again, just sometimes is an acceptance piece in supervision. So what can you do as a supervisor? You know, if you're doing remote supervision and you're not familiar with the area, or if you're thinking about moving to an area, study maps. Of course, I love maps. But visit, drive around, walk around, get out of the car. You know, books are a window on the world, so read nonfiction and fiction. Go to local bookstores. You know, in small towns, there may not be a bookstore, but you can go to local bookstore wherever the nearest one is. Definitely, we've got a couple of independent bookstores in Albuquerque and Santa Fe where you can find good New Mexico books. The libraries, read the local paper. Definitely great source, rich source of information. Talk to people, go to the county fair. County fairs are awesome. They only happen once a year though. So farmers markets are on a smaller scale, happening a lot more often. Flea markets also. Just really thinking in terms of history, community leadership, the economy. What does this area survive on? What's the economy based on? The environment, the educational system, particular socio-political issues, and those recreational activities. Check out the census data. The quantitative side of things can be helpful as well. New Mexico Department of Health and the New Mexico Human Services Department both have data books online. And so if you Google those, you can get to that info, and that gives you a snapshot of things as well. I love this quote. I'm able to impact the profession even though I'm not geographically close to supervisees. I'm able to support quality service that might not otherwise be available in that geographic area. And I'm staying up to date by using technology in the progression of our field. So if you do have that opportunity to do some remote supervision, it can be very rewarding. I certainly have found it very rewarding now that I am living in the metro area. I'm not in a rural area anymore, but I've had the opportunity to do supervision with folks who are out in other parts of the state, and I love it. And I learn a lot from them. Here's a quote from a rural supervisor. In a rural community, I like being able to see the changes in my small community. I get to watch small changes develop to a bigger scale and help families for generations. How cool is that? Very, very cool. So experience the community fully, and this isn't just about learning about the community if you're not familiar, but also if you do live there, finding those opportunities to get out. I think something many of us have experienced in our practice is that if you're working with very vulnerable groups or more severe clinical populations, it can start to seem like the whole world is doing poorly. But the whole world isn't doing poorly. So get out, get to community events, high school sports, local cultural events, do stuff and see how the other half lives. There are people out there who are thriving. And so being part of that. Now, again, the challenge, especially in much smaller communities, is that you do have to sort of maintain this awareness that you're in a fishbowl. People know you work over there at the mental health center, or whatever it is that you do. And so you have to be aware that there may be eyes on you, or you may run into somebody. Those social relationships may be a little less available, but there are other professionals who are in the same boat, and so maybe those are the people you connect with, right? You're able to have a closer relationship with some of those folks, whether it's the school principal, or the person who works over at another local nonprofit in a leadership role. Those opportunities are there. Good to remember the 4 A's of rural mental health, just in terms of kind of having maybe a compass or a guide and supervision. These are some key concepts: accessibility, affordability, availability, and acceptability. And I think we've touched on most of those. And I also mentioned this, that sometimes the strengths and challenges are two sides of the same coin. There's sort of a dialectic or tension between the strengths and challenges. And that can be helpful just in terms of dealing with some of the challenges, but in terms of pulling on some of the strengths, but also realizing how the challenges are not all bad. Like the gossip that can exist in a smaller community is also a product of those very close relationships that everybody has. So the gossip isn't inherently bad. Now, sometimes it can definitely go too far and be hurtful. It can be destructive. But the fact that everybody shares things with one another is not inherently bad. So just having that awareness of the tension. Definitely something I found in rural communities is that even though my resources are scarce, I know exactly what there is, and I know exactly who to go to, and they know me. And I think that somebody had mentioned that in the chat as well. And I do think that that's very true, and it's something that you can certainly cultivate. Just a kind of lengthy list here of some things to be aware of. I think I've mentioned most of these. One thing I hadn't said yet is really thinking in terms of developmental and lifespan approaches. I do think that that can be very helpful given this very broad context, this generalist scope of practice that you're dealing with. Leadership, very important. We're professionals. We're going to move to those leadership roles, and your supervisees will pretty quickly move to those roles in the years ahead. So getting them thinking about leadership, and really cultivating those consultation and mentoring relationships to counteract that professional and social isolation that can occur. So please do this. Write down one thing you will do within the next week to strengthen clinical supervision and workforce development in our state. One thing. You could buy one of these atlases. I love these atlases. I've owned both of them. They're each slightly different. But if you want to go exploring, this is the way to do it. Not a map on your cell phone. That's good if you're trying to get to an appointment at a certain location at a certain time. But if you want to go exploring, get a New Mexico atlas. So with that, I will wrap up. The references are here. If you want those, then you can send a note to Alex. Thank you, everybody, for your time.
Thanks, Chris. And that's the QR code for the survey for the CE certificate. And I'll put my email in the chat now in case you want a PDF of the PowerPoint. And just let me know if you have any questions regarding CEs. You can message me directly. But really appreciate you, Chris. Thanks for everything.
You bet. Thank you. Appreciate the opportunity.
Thanks, everybody.